Hello, I'm Dr. Hasan Haider. I'm a GMU alumni from the 2015 batch. I work now as a general practitioner over here at Tumbe University Hospital at the inpatient wards. Allow me to take you through what an average day in my job would look like. Being a part of the GMU Alum Network has benefited me immensely. I've met with some absolutely brilliant doctors, be them surgeons or internal medicine specialists, doctors who have really taught me some of the most essential things that I know, and that have also provided me with some very much appreciated referrals. Not to mention that being a GMU graduate, I've been given a unique opportunity to join a network of hospitals that spans the entire UAE. Thanks to GMU that I'm able to work in a multidisciplinary, multi-specialty teaching hospital. One thing our tutors always told us during classes was that anatomy is everything. And it's not until you get into real clinical practice that you realize just how true that is. To give you an example from my own practice, during emergence, in my time at the emergency department, we order a lot of radiological studies, a lot of x-rays, a lot of CT scans. And we are in a situation where we have to interpret the study that's right in front of us. And that's when your basic anatomical knowledge really comes in handy. And you really have to know, you have to know your x-rays, you have to know all your bony landmarks, you have to know what your soft tissues. All of that information really does come in handy when you're making real decisions about real patients in front of you. My time at GMU has had a profoundly positive and long-lasting effect on my current career as a physician. Over here, I've had access to quite extensive library of medical literature and medical resources. I've had the support of some very excellent tutors and clinical teachers. I've also been part of a very diverse student body who kind of challenged me to keep improving myself. All of these things have kind of led me to develop some very critical thinking skills, have led me to develop some skills of independent learning, which I find to be quite invaluable in my current career today. I can research information about a patient, or I can look up what the most ideal modality of treatment for a certain case is, all by using learning techniques and resource gathering techniques that were instilled in me during my time here as a student. I have quite a lot of quite memorable experiences in this university. I remember spending a lot of time out here in this park. During self-study sessions where we probably should have been studying, we'd just be out here, me and some friends, maybe a few cups of tea, just sitting on the grass, chatting the day away. One piece of advice I would have for current students is that you should just enjoy yourself. These are the first ever years in your medical journey, and they're going to be some of your most memorable years. Some of the friendships you form here are going to last you for a very long time, especially after you graduate and you take on more responsibilities. So of course you should hang out, you should enjoy each other's company, but at the same time you should also be building your own network. Whatever connections you make here are gonna help you open future paths for your career and for your future advancement.